Hey guys, Tammy here, and in this video, we are going to talk about when your children need medication. Now, this is one of those issues when you're in court and you're involved in the court process, you've sort of put yourself in a position where that judge is the super parent, right? Where they get to kind of make the final decisions if you and the other parent don't agree. And I think we saw a lot around this during COVID, around the vaccination specifically, but I'm not going to talk so much about that. I just want to talk about, treatment, like when your kids need medication for things and maybe you don't agree or whatever, and kind of how the court comes at that and, what you can do about it. Before we dive into the topic, let me just remind you, if you like the content, don't forget to hit like on this video. Also subscribe to the channel so that you get notified as new videos are released. And please make sure you're subscribing. Okay, I know I just said that, but please, please, please make sure you're subscribing. 70% of you are not subscribed. So I'm waiting. I expect a 70% increase in subscribers. Okay, so start clicking that button. So let's talk about when the kid needs medication. Now, the most common things that I see, medications for ADD is a big one. Sometimes you have one parent that wants to give it, one that doesn't. I have seen children that need to be medicated for allergies, which tends to be a little less critical. And a pill like that, you can kind of, if they have it some days and not others, it's more effective, obviously, if they get it all the time, but it's not the end of the world, right? Or things like anxiety. I've got a couple clients who have children that are being treated for anxiety. And in many of these cases, mom and dad don't agree on whether the child should be medicated or shouldn't be medicated. And so when you don't agree, what happens? Well, usually what happens is that one parent ends up filing in court. The parent that, particularly wants to give the medication, obviously, will end up filing in court because that's really the only way to resolve the dispute, unless you go into mediation and you're able to resolve it that way, or unless maybe you have a co-parenting counselor or parenting coordinator or some sort of decision maker that the court has put in place, or maybe you have minors counsel or something like that where you can get some help and input. But if you're kind of in between court processes and you're just kind of going in the flow, and then all of a sudden your child gets diagnosed and needs some kind of medication, well, usually in that case, we're looking at filing and going back to court. Here comes the dilemma. Okay, the court relies on physician recommendations, psychiatrists' recommendations. So if a professional, a physician or a psychiatrist is recommending that your child have medication and be treated, then the court is going to tend to follow that because the court's going to go with that expert, pediatrician or whatever, their guidance. They're going to go with that expert's guidance because they're going to go, well, I'm not a doctor. I don't know. Their job is to try to not bring their own personal bias into it, right? Whatever that is. And so they're really going to rely on that expert's recommendation. And let's face it, if we're seeing a medical physician, most of them, prescribe and advocate for medication in certain circumstances. So if that's the recommendation that's coming, that's probably going to be the outcome in most cases. I think you guys have probably even heard me talk about within the last few years, I had a friend here in San Diego who the other parent wanted to give the child medication to stop the puberty process so that they could transition to the other gender. And so here in California, the court even allowed that medication. So I know, because one of the parents wanted it and the other one didn't. So I know that, California is kind of a little different than the rest of the US. I grew up in Kentucky where it was a little more conservative. So I get that not everybody is California, but I'm just saying that it's, it's a little bit scary because the court does rely very heavily on that physician and whatever their recommendation is. Now, I know also sometimes we're seeing holistic health practitioners or other people that are maybe recommending alternative modalities. But honestly, if you have a physician involved, like an MD, and then you have an alternative medicine person involved, I think the vast majority of courts are going to go with what that physician or MD recommends. That's just going to be the default most of the time. Sometimes what happens is that we're, giving them medicine and maybe the other parent goes along. And I see this a lot with like ADD medication where, the parents don't necessarily disagree, but one parent just either doesn't give it at their home, either because they're just not on top of it or they forget, or, they were kind of forced into agreeing with giving the meds, but they don't really want to. And one of the things that I can tell you in that situation is that what you have to do is document, okay? And I don't think this is as applicable when we're talking about something like as needed, medicine like an allergy pill if it's ordered as needed, or anti-anxiety that's ordered as needed or something like that. But something that is more like the ADD type of medication where a child needs it every single day consistently, or maybe they have some other health issue where they need a medicine every day consistently and it has, an overall systemic effect, then in those situations, you really do have to go through the process of kind of documenting. And I think what most of us want to do is as soon as the other parent misses one dose or doesn't give it, a lot of times we're thinking there's something we can do right then. And most of the time there isn't. With most of these types of issues, you have to be able to show a pattern of behavior. And I know you hear me use that phrase a lot, but anytime there's a one-off with something where somebody didn't give medication on a certain night or whatever, the court tends to have a little grace, right? And tends to go, okay, well, we're human beings, right? We make mistakes. Maybe the parent forgot, maybe it was an exceptionally late night. The kid was asleep before the parent remembered, whatever it was. The court is going, maybe the parent ran out of meds, didn't get a chance to go to the pharmacy to get it refilled, whatever. And so they're going to kind of, for a one-off or maybe even a two-off, they're going to have that little bit of grace. But when we start getting into showing a pattern, if you can show that like, hey, every week when the child is in the other parent's care, they're not getting their medicine 2 out of 3 nights, or maybe it always happens on Tuesday evening or whatever it is. Now, this is hard because most of the time it's just you're going on what the child's telling you, right? Which can also be a little difficult. But if we're talking about something like ADD, maybe you talk to the teacher and find out like, do you notice any pattern to certain days of the week that the child struggles in class, or anything like that? Don't tell them you're fishing for information on the other parent not giving the meds, but just ask them for their objective input of, hey, do you notice any kind of pattern of does the child struggle more on some weekdays than others? Have you ever noticed any consistency? And the teacher might say no, and you could say, well, could you maybe try to keep track of that and see, the child transitions back and forth between the two homes. And I would just like to figure out if there's something within those transitions that is affecting this, that we could do. And that gives you kind of a diplomatic way of asking them to be able to track that. So if you start to be able to show a pattern, especially using outside resources like, a therapist, a school counselor, a teacher, somebody like that, that can confirm, yes, every Wednesday this child seems to struggle more or have more issues or whatever, and we know Tuesday night is the other parent's night, then that starts giving credibility to what you're saying about, the pattern of this recurring. And so you have to document that and you have to let it happen. And I think that's the hardest part for people a lot of times with any situation like this is letting those things happen, because we're going, really, I have to let my child struggle and suffer in this way in order to prove this? And the answer to that is, yeah, sometimes you do. Because again, we don't want this to just be a one-off or even a two-off. We want to be able to show that, look, this is a consistent pattern that's happening over several months and it's happening multiple times. And then when you bring that kind of pattern of behavior into the court, it has a lot more credibility. And I've even seen in the instance where parents aren't giving meds and should be, I have seen that parent have their parenting time decreased because of that issue. So It's a big problem, and if you're under court order, you know, that your child gets certain meds or whatever, you need to do that. And honestly, if you have a pediatrician recommending something, going against it is going to be an uphill battle. So you have to think about the cost benefit analysis of all this before you plow forward with having the court decide the final outcome of it. Okay. If you'd like some help with discerning these types of topics and situations and how to handle them, you can go to divorceuniversityonline.com/VIP-coaching. There's a link on that page. You can book a time to speak to a member of my staff, learn more about my services, and how I might be able to support you in your child custody journey. See you guys next time.